Okay, welcome everyone to our PFCC February Connect virtual discussion on building patient and family advisors' capacity for influence. I am joined, I'm Mary Minetti, Senior Policy and Programming Specialist, and I'm joined by my colleagues Marie Abraham, who's Vice President of Programming and Publications, and for today's call, she's going to be our chat monitor. And thank you for doing that, Marie. And then we also have Natasha Reed, our Registration and Database Manager, joining us. And without Natasha, you wouldn't be seeing these slides. And you probably wouldn't be hearing me, and the polls wouldn't work. So Natasha is a very important member of the team that allows us to virtually connect and have the opportunity to learn from each other. So I appreciate those of you that have chatted in already, who you are and where you're from. I also appreciate those of you that have put yourselves on mute until we get into the big part of the conversation. That helps in just kind of setting the stage and not having background noise. So thanks so much. I see that many of you are online and we can see your wonderful faces, and some of you are joining us just by phone. Either way is great. The fact that you're here is wonderful. This is an important conversation because the partnership between patients and family advisors and our healthcare organizations is essential to improving quality and safety. And so we want to make sure that we're really sharing with each other our best practices and our learning about how to engage and sustain the interests of patient and family advisors and help them develop skills and enhance their ability to make a positive difference in the organization. Go ahead to the next slide, please, Natasha. So I see a lot of chatting in of names and organizations. We're going to use 3 polls, a couple to just kind of ground us in where people are from and what roles they are filling, and then a little bit about what people are currently doing. This is unlike our webinars in that we are not going to be doing a presentation specifically, but my role is really to facilitate a conversation and encourage you to share with each other what you're doing, what your challenges are, what you're hoping to do. We are recording this conversation, and Natasha, again, our wonderful technical assistant, will be putting resources in the recording as well as the chat record and the poll records into our PFCC Connect conversation folder. And we have folders by each of the different topics. So we encourage you to use chat, not only to let us know who you are, but also to share any resources or ideas with us. So
what are they called?
Sounds like somebody,
PFCC.
sounds like somebody is asking a question. I'm not sure. If you have a question, if you can chat it in, that great. So I am going to go to the next slide, and that is one where in just a moment the actual poll will appear. Natasha's trying to bring the poll up. Oh, there it is. So if each of you can just take a look at this poll really quickly and click on which is your primary healthcare setting where you're working. And I encourage all of you to mute your computer if you're on the phone so that we don't get an echo. That'd be great. But let us know which of these settings that you're working in. It's always helpful to know where people are doing their great partnership work. And Natasha, you could probably at some point go back to the old slides, but this will work for now. And I kind of rely on Natasha to let us know when we have enough responses to the poll. We have 51 participants joining the call today. Now I'm for those of you that aren't on video, you may still be hopefully joining by computer so that you can see the poll and let us know what setting that you're from. We love it when we have really a multitude of people from a variety of settings, because it's through that opportunity to share with each other their your different settings that ideas can transfer from one setting to another, but also it's helpful for people to know if there are others on the call that are in their same setting. Natasha, I'm hoping that you can close the poll and show us the results.
I'm actually going to relaunch this poll. I didn't get any responses for it.
Are people seeing the poll?
I see responses, by the way, if you want.
Oh, I'm still dialing in.
Okay, so
Okay,
Marie, is that because you're in as a co-host as opposed to a
that might be.
participant? Yeah, so we may have a little bit of a technical glitch. Can you bring up your screen if you can see the results of the poll and Natasha
Yes.
can't?
I will.
We'll have to figure out that glitch again. Looks like a number of people responded, but they couldn't see the results.
Can you see them? So we got most.
I see a beautiful picture of some fog and grass.
You don't see the poll results?
Nope. Mm-mm.
Okay, I'm going to stop sharing because you don't need to see that. I will tell you that there's 61% of hospitals. There's a little few folks of primary care and ambulatory care. That we have other community nonprofits, and then I know we have a mental health and home health.
Okay. Great. So did you share what the percentage of primary care was?
It was just one from primary care and one from ambulatory care.
Okay, great. Thanks.
Yep.
So I'm sorry that I apologize for you not being able to visually see, but it looks like the majority, more than half, are involved with hospitals and medical centers. And I love that we've got some mental health and primary care folks and community folks as well. Let's go to the next poll. And Natasha, I'd like for you to bring that up. It looks like a lot of people were able to see the polls. So this has to do with your current role at your organization. And if you can just let us know. And it would be your primary role at the organization. So if you're coordinator, if you're patient and family advisor, if you work in the patient experience office. I know sometimes we wear more than one hat, but your primary role would be the great one for us to be able to see. And then Natasha and Marie, we're going to have to figure out how we share results.
Okay, I can share the percentages if you'd like, but we only have about 68 folks who've completed it, but we're getting more. So let's
Great. Well, we'll give you
wait
just a minute.
Yep.
I always like to say while people are looking at the poll and making their choices that the diversity and the number of people from different perspectives can really enhance the kinds of solutions and approaches that we have.
Hi.
Because they come from different perspectives.
Okay. So we have about, so we have about 80% who has responded.
We're still kind of asking
Okay.
some questions right now.
We've got the same number of patient and family advisors and coordinators responsible for implementing patient family-centered initiatives. So we've got 70% of those. We have
So hold on a minute, Marie. We've got some folks that aren't on mute. Stephanie in particular, if you can put yourself on mute, then we'll be able to hear what the results of the poll are from Marie. That'd be great. So what was the percentage of patient and family advisors?
Patient and family advisors and coordinators both came in at 17%, Mary. We do have 28%, the highest number of patient experience, patient relations personnel. We have about 11% of measurement quality improvement staff, 9% are administrative and clinical leaders, And then we have 7% as community program and 7% as coming in as other, but I don't see that they've chatted in where they are, what the other is, so I can't.
Okay,
Oh,
great.
well, no, I do see it. Sorry. Somebody said that they work across a number of settings.
Okay. Great. Good. So we've got a really nice mix of people from a variety of roles, and I'm always excited to see a high percentage of patient and family advisors. And it seems like they're pretty even split. It's not like we've got this huge, you know, more than half in any one role, which I really love. So if we can go to the next slide, I'm going to go ahead and tee up this conversation. And let me. So the reason that this particular topic came up was last month in January, we had a conversation about how to celebrate partnerships and what are the different ways that people were celebrating partnerships. And we spent about half of our hour talking about that and learning from each other. But then the rest of the time, we brainstormed different topics that we thought would be good topics, the people who were on the call, good topics to have for these conversations. And a high percentage of people were really interested in how we really sorry, the chat came in that was a little that I'm hoping perhaps that Marie can respond to about having trouble getting into the.
I don't see that, so.
So anyway, let me just get refocused. So one of the really important topics that came up were how do we sustain the momentum of the PFACs and the patient and family advisors. And then as we explored that topic, we broke down it into a number of areas that we could focus on, one of which was how do we support individuals who start as patient and family advisors to build skills, develop competencies, become able to, in a sense, get promoted within the organization and have a wider variety of experiences. And so that's why we decided to have this conversation. And we want to hear both from those who are in organizations, but also those who are working as in partnership as patient and family advisors. But I wanted to start by really talking about that people become patient and family advisors for a specific reason. Everyone has a why. Sometimes it's that people want to give back. Others want to learn new things and continue to grow their skills. People want to make a difference. Sometimes it's a variety of reasons why people are really interested in being patient and family advisors. And paying attention to those reasons is really an important, a very important thing to keep in mind, because if we're going to support people, understanding what their motivation to participate is and providing them with opportunities for that kind of participation, where they can make a difference, where they can learn, where they can see that they're giving back, can really make a difference in terms of their ability to feel like it's very important to participate. So you, Natasha, were really anticipating that I was gonna lead into that. What I wanna do to start with the level setting is to find out with the people that are on the call, a poll that really is going to really talk about and have you check any of the things that are listed. And this isn't a comprehensive list, it's just a specific let's get started list to see what people are already doing. But what are some of the activities that you provide, or if you're a patient and family advisor and that's 17% of you, what have you experienced with your organizations that have helped you to be continuing to develop as a PFA in that organization? And so we have a number of things like how we orient, whether written materials like an orientation manual are provided, the ability and the opportunity to meet leaders whether you've been able to participate in specific training that's helped you be able to be integrated into the organization, being able to have a peer or a mentor coach, or actually having the process of on a yearly basis meeting with somebody to evaluate how your experience is going and what you can do and what they can do to help support you in being a positive influence in the organization. So again, I apologize that the poll is not going to show the results, but in a moment after everybody responds, then Marie is going to let us know what the results are, and then we'll start with some discussion and learn more from people. And at that point, we'll ask you to come off of mute if things are quiet in your background so that you can fully participate. But I'll give you just a minute to look at those things. And I don't see other as a category, but if there are things that you're doing with patient and family advisors, or things as an advisor that you've been offered to help support your continued development in the PFA role, you can chat that in as well. Because I don't see other as a category, but I did want
other is a category, Mary. You might not be able to see it on your screen, but and so people, and we have a 15% of people choosing that. So
oh, okay, so good. We're going to get some great ideas when people chat in what the other is that they're doing to support.
Okay, I think that
Capacity building.
Natasha closed that out. So let me just let you know the number one at 71% was met with a key leader or chair of committee to discuss the role. Number two is at 59% was orientation to the organization as well as the role of PFA in face-to-face training. 35%, so number three, was provided an orientation manual to review prior to the first meeting. And right behind that are two at 26% that was participated in training on communication skills, working in a group with others in organization. And then 24% say they were assigned a mentor, coach, an experienced PFA or staff. 24% also said that they participated in community offered training. That would be interesting to talk about. And then we have a number of people, 18%, excuse me, meet yearly to review their progress, the individual PFA progress, and identify training goals. And then 15% said other, and I believe we are getting a few chats. Member, mentor, and high impact speaking workshops was one of the things chatted in. Lots more to add to the list. I have a chat, but perhaps we could get that. So those are the answers, Mary.
Great.
And everyone.
Well, this is pretty exciting. And one of the things that you did and others that signed up and registered actually also listed their questions that or areas that they wanted to have conversation about. And I'd like to start before we get into those questions with some of the things that people are currently doing and encourage people to share some of these things. Since so many people, 71%, said that they met with a key leader or a chair of a committee to discuss the role, I'm wondering if we can have a couple people share specifically how they do that and what's covered in that meeting with the key leader and what the goal of it is. And I'm going to start by calling on a couple people to start with, but then we can open up the discussion for other people to chime in. Kate from Providence Healthcare, who is a leader of person and family-centered care, can you talk a little bit about the kinds of things that you're doing and whether or not you have set up key leadership meetings as ways to bring and invite patient and family advisors into partnership with your organization?
Of course, thanks. And can people hear me okay?
Just a little louder, Kate, and I think we'll be able to hear you, especially if other people stay on mute.
Okay.
Go ahead.
All right. I'll use my outside. At our organization, we have been advisors for many years now, and so it's not unusual for our leaders here to hear from us, from me, my office here, that that we have found somebody who's interested in some committee work or project work that they're hoping to lead in their department or their area, and so they're quite ready for the call to
Mary,
Yes.
could I just break in for a second? Because we are having some difficulty hearing Kate, and people are chatting in that it's because of the background noise. So if everyone could go on mute, if you're not speaking, that would be so helpful. Kate, I'm sorry. Would you mind starting again? Because I think we had difficulty hearing you just from the background noise.
Okay, I'll try that again.
Oh,
That's much better.
Sorry, just to reset myself. The leaders of the organization typically come to me or involve me when they are planning to have a new engagement. And part of the conversation that we have is where I'm clear on the expectation.
Kate, we lost you.
Yeah. Part of the conversation that we have is with the leaders are well prepared to make some time to have a conversation with the patient partner to demonstrate that they're going to support that person through the engagement, whether it's for a longer term committee work or short term project. Conversation or questions as to what is going to happen. I'm not sure if there's anything else that would be helpful there for folks.
Great, thanks. So I'm wondering if Julie Glover, I believe you're on the line. You want to talk a little bit about what you're doing to prepare your patient and family advisors and building their capacity to have more influence in your organization? I know we've been asked if our tech person can fix the audio problem, but if she mutes everybody, then the only people that'll be able to talk are Marie and I and Natasha. So for those of you that are on the line, the mute button, if you're on your computer, is at the bottom left of the screen, and it looks like a microphone, and you just click on it. If you're on a phone and not on the computer screen and just listening into this conversation, most phones do have a mute button on it, whether they're cell phones or not. So I encourage you to do that. So Julie, did you want to share with the group? I don't see her on the call anymore.
Julie is on the call, but she may have joined by my phone because I don't see a microphone next to her name, but I do see her still
Okay.
on the line. So Julie, maybe we can come back to Julie, Mary.
Yeah. So Sarah Eaton from Colorado, I know that you're on the line. Can you take yourself off mute and share with us you're from a community program, the kinds of things that you're doing to prepare your patient and family advisors, and a little bit about your organization? Huh. Sarah, you're on mute. Oh, there you go.
Yeah. Oh, thank you. I'm on the phone. Can you hear me?
I can.
Okay, great. I don't know if you heard the little introduction.
I didn't, because you were on mute.
Okay. Okay. So my name's Sarah Eaton, and I facilitate and coordinate our Member Experience Advisory Council for Colorado's Medicaid program, which is called Health First Colorado. We're about to celebrate our five years of being together as a group, but and things have changed a little bit over that time. I would say the big thing that worked for us in the very beginning as part of our recruitment process is I spend at least 30 minutes on the phone with each person that I interview and sort of help them get an idea of what to expect, what that their role will be more on the advisory side, and that the group is not a decision-making body, but we do try to take as much feedback as we possibly can, and then follow up to let them know what we did and didn't change, and why not if we weren't able to change things. We offer some training and things throughout, but in the beginning, I've asked regularly throughout our 5 years about any other ways that they feel like they could be better onboarded, I guess. And typically it's sort of like just jumping in the deep end with the rest of the group, and they're sort of unofficially mentored by advisors who've been on the group for a little bit longer, has been their preferred method.
Great. Do you use mentors at all?
Not officially, but I would say the people who have been in the council for a little bit longer generally take some of the newer people under their wing. So we're not necessarily training them to do that, but they just naturally gravitate in that direction.
Mm-hmm. Great. I know we've got 17% of the people on the line are patient and family advisors, and I wondered if one of you would be interested in sharing what you have found particularly helpful to prepare you for the PFA role and helps you stay excited about the difference that you're making in your organization.
Hi, this is Joan Maxwell. I'm at John Muir Health in Northern California.
Hi, Joan.
Hi, I would say what works best for me is when we have kind of an annual plan, we set goals of what we want to accomplish that are fairly specific, and then that we follow up and have like speakers come to the meetings from different parts of the hospital that we want to get involved in, and we can kind of have group discussions that always seem to be very productive and robust. So I think it's kind of the planning combined with then giving us really good information that helps us give the best possible input.
Great, great. Thanks for sharing that, Joan. Are there other things, are there other PFAs on the line that want to share what they've, what their experience has been?
Hi, this is Donna Druin. Can you hear me?
Yes.
Hi there. In addition to that, we do have clear roles and responsibilities defined. We do have a document that lays out the whole process for the Patient and Family Advisory Council. We do assign mentors as others do, and we actually do screening interviews prior to bringing new members on board. Then they're assigned the mentors. We have pre-meetings prior to the first meeting so they'll know what to expect. And then they can stay with that, that mentor right through some of the committees. We have people on 25 hospital committees, PFAC members. And we also submit an annual report. And that annual report, excuse me, has metrics in it with respect to what's been accomplished for the year. And let me see, there's one more thing. Oh, we do have presentations by all of the senior staff from the hospital regarding their particular area of the organization. And what that enables us to do is to help people understand how the healthcare system works in general, and then how it impacts the hospital. So what's important about that is sometimes you'll get folks who think that they would like to come in and kind of change the world. And in fact, that part of the world has nothing to do with healthcare, but more to do with the financial aspect of the business. But it's also important for them to understand the financial aspect of, in our case, of the hospital, so that they can appreciate and understand where some of the limitations might be. And then finally, I do want to give a shout out to IPFCC because we have learned so much. Our hospital has been wonderful. For a couple of years, they have sponsored. We've done some presentations with IPFCC, but the value of attending, especially the annual meeting, is phenomenal because we've stolen some ideas that others have had and implemented with great success. Thanks.
So there was Donna, how are advisors invited to senior leader presentations?
No, the senior leaders come in and present to our advisory council.
Oh, so they come to you.
Yeah. And we also offer tours through the hospital. So for instance, we will have the medication, the pharmacy come in. They'll do a presentation about their business, and we'll also go and visit the pharmacy. It's incredible. I mean, there's so much information that people, you kind of make it up in your head of what might happen, but when you actually see it, there's a wonderful appreciation.
Great. Well, thanks. It sounds like it's pretty comprehensive in the ways that your organization helps prepare advisors and bring them in. For those of you that mentioned that there was some mentor matches, can you talk a little bit about how you identify the mentors and what kind of support, coaching and or training that you provide mentors for that role? It's kind of an elevated role. I would think it's kind of a senior role for patient and family advisors that have been in the organization for a while, but I'm curious if there's any kind of specific training that's happening.
Mary, you're right on target. We use all of our senior people to be mentors for the new folks coming in, and it's worked beautifully. But we also are very specific when we bring them in ahead of the first meeting so that they know what to anticipate. And we also share that they're expected to participate on the hospital committees. It's a soft requirement that they participate on the hospital activities as well.
So, so there's some orientation for those that are going into mentorship roles, it sounds like, Donna.
Yeah, plus they've been doing it. We have a core of folks who have been doing it, and that core continues to grow. They're amazing. They're absolutely amazing.
Okay, great. Well, I want to just.
There's a question, Mary. There's a few actually. Just how often are the new advisors added? So is it coming in yearly? How do you do that? That's from Lillian. And then we've got another question if somebody wants to respond to that.
So it's Donna. I can share with you how we do it.
Sure.
We do have,
others are welcome as well after Donna.
Yeah, absolutely. I'm sorry. But we do have basically their job descriptions, I guess for lack of a better word. But the nice part about that is that the mentor will stay with that individual if they're going to, if they're working on a specific assignment. They're right there at the end of an email or the end of a telephone or any other way that they've made arrangements to stay linked together and help them through any questions. But we've been very fortunate in that we've brought on some people who have had either some experience in change management or in working with a team, and also with being able to take control of a specific project.
Do advisors start, can a new advisor start every month, or do you bring people in on a monthly, on a yearly basis? Or is it kind of a revolving? kind of invitation for people to start?
We have I'll just answer, Mary, just quickly. We have a set number of advisors. If someone has to leave, and it could be for multiple reasons, either they moved or illness or something else, then we'll replace that advisor.
Okay. So it could happen any time of the year, depending on when the opening occurs.
Yeah.
What about other people?
Yeah.
And we have bylaws that set terms as well, term limits. Nobody wants to leave them.
So what about others?
Hi, this is Sarah again from Colorado. We found out the hard way that it works better for us to rotate bringing new members on instead of sort of bringing on a bigger group at one point, obviously, because we, when they rotate off and finish their term, then we're kind of left in the same position of bringing on a whole bunch of new people and not having that opportunity for some of the longer term members to build the relationships and kind of show the way for the newer people. So we kind of just, I really look at our list from a month-to-month basis and kind of decide. We do have a target number that we like to keep it to as well, but we recruit about 3 to 5 over that just to make sure that we have enough people in the room each month.
I noticed that there was another question about whether PFAs are paid for their participation. Is there anyone on the line that pays their PFAs for participation? Gary?
We have Angela Miney, who chatted in that she does have a paid position as a family advisor. It's grant funded. So I don't know if Angela wants to talk about that, or there are others on the line who also have the same. We have Joan. Joan says you're unpaid. So, okay, we're getting a number of questions in too. So does anyone want to speak to the pay or compensated or incentivized before we move on?
Hi, this is Lena from Toronto, Ontario.
Hi, Lena.
Hi. And I just wanted to mention that in terms of compensation, and this is actually for our entire volunteer program, we compensate their parking at the hospital. And so whereas staff and visitors have to pay, their compensation comes in the form of free parking at any of our hospitals while they're here for advisor purposes or volunteer duties.
Okay, great.
And just to finish up on this, Sarah has chatted in. Sarah, I don't know if you want to speak to that directly, since you can unmute yourself, but you're a different type of agency, so it's a little different for you.
Yeah, so because we're a government agency, it's hard to get advisors on the payroll. And we also, what I didn't put in the chat, because we're working with lower income population, we have to think about how any compensation we give them might affect their eligibility for Medicaid. And so we do gift cards for them for each meeting, and then we provide meals. Our meetings are 4 hours, so we do breakfast and lunch. And then if people are coming from, since we're a large state, that we have people coming from longer distances, we can cover a hotel stay for the night before, and then we provide parking and reimburse for mileage and childcare if that's needed as well.
Great. And I noticed that Gary Galunas is, according to my technology, is trying to talk, but Gary, we can't hear you. Is your volume down?
Oh, I'm sorry. I must have accidentally hit the mute button or unmuted my phone.
Great. Well, you're unmuted now. We can hear you. What would you like to say?
Oh, I was just saying that I was just, in fact, trying to type a message, but I'll just say that I'm an unpaid advisor too. But we get closer in parking and an allowance in the cafeteria for every time we're in the hospital. So that's about it, though.
Gary, how long have you been an advisor?
About two and a half years now. So
what
I'm really fairly young at it.
Yeah. And what did you find most helpful as you were coming into the organization that helped you kind of get integrated and feel comfortable being a participant, actively partnering with the organization?
Well, one of the things, that I just thought was absolutely fabulous. One of the things that we have at our hospital are what we call Kaizens, or 2-day short process improvement projects. And they can happen in any type of unit in the hospital. And we are offered opportunities to be part of these. And that has just been so invaluable to me to learn about the whole, how a hospital works, to become familiar with the staff and things like that. So, example, the first Kaizen I was on purposeful hourly rounding. And so I was paired with a nurse, and we observed other nurses doing hourly rounds for 2 days and worked on coming up with processes that or procedures that would maybe make this better than what it was, and try to do that. But working with the staff for 2 days like this gets you much more involved in the processes that are at your hospital, and you become much more familiar with the staff. And I've been on like 6 of these now over the last 2 years, and in all different areas. One of the other ones I was on the Meds to Beds program, where getting medication delivered bedside when a patient is discharged. And so we were working with a nurse and a pharmacist and everything on that, and just trying to follow the process, see where bottlenecks were. And for someone whose background was in IT, not in healthcare, it was very important for me to try to learn the ins and outs of how a hospital works, and some of the terminology and the people that work there, even the organizational structure is set up.
Great.
So that really helped me.
And Larry, just to build on that, that gives the individuals who are actually doing the work the opportunity to see a lot as well. That's been really successful. Engaging our PFAC members with the hospital teams. That's an awesome. Thanks.
And it seems like it's, in a sense, when we talk about building capacity, it's building knowledge and capacity kind of on the job, as it were, as you're working on a project, which is great. I want to just go back to a bunch of, there's just been a lot related to compensation in the chat for those of you that haven't had a chance to take a look at it. And Lindsay Galley from the PFA network developed a work group, and they developed a guidance document and have put the link in the chat for any of you. Lindsay, did you?
Marion, I just put it again. I just copied and pasted it again, so it's at the very bottom of everybody's chat if they want to take note of that, because it's an excellent resource.
Yeah. So, Lindsay, did you want to say anything about that really briefly?
Sure, just really quickly. The PFA network, a group of patient family advisors, really saw a need to actually address diversity in patient family advisory councils and patient family engagement. And kind of the statement that this work group focused on that was driven off of was that volunteerism is a privilege. So how can we make being able to volunteer more equitable? And so that's how we came to compensation. And so the work group met for, I think, a little over 6 months, maybe 6 months to a year. And they did an environmental scan of current compensation practices, which can be found on the website that was shared. And then they put together a guidance document as well. That's still kind of a working document. They're looking to also add vignettes of some of those current practices. So yeah, I think it's an ongoing conversation, especially really creating more equitable ways that patients and families can participate in this way. And we're always learning more. So that's why we're here.
Yeah, great. Well, thank you for sharing that.
Of course.
One we are, we've got about 15 minutes left, and I haven't even shown you the questions that other people have come up with.
Yes.
But
So could we just, I think there might be a quick answer to a few, Mary, if you don't mind.
You bet.
Does the number of advisors depend on the size of the facility? If anybody wants to chat in a response to that question. So do your organizations, do you think about the size of your facility and how many advisors you're going to bring in? And then we've got another question, and then we can go back to Mary, that broader discussion about, Ashley Allen is asking about if anyone has run a council for children and adults. So they right now run the children's, she does run the Children's Family Advisory Council and PEDS, and it's a completely different world. So it's a challenge to them to keep it professional rather than a support system when our members are still neck deep in their child's condition and hospital experience. I think that's something that you all have talked about in preparing patients and families, and I've heard this come in. So if anybody wants to respond to either of those in chat, that would be great.
Okay. Great. So Natasha, if you want to go to the next slide. So these were some of the key areas of discussion that the group wanted to talk about. And one of the things that I don't think we've heard some stories about what meaningful engagement is. There's lots of material out on our website about recruitment strategies for patient and family advisors, including a report on how to recruit for diversity. But I'm interested in knowing how organizations are mindful about keeping the partnership going for patient and family advisors who've been with the organization longer. Thoughts and ideas, anything mindful? I've got somebody who's talking that I don't have a name, I just have a number, but we couldn't hear you, so.
Can unmute?
They might want to unmute. If you have something to share about keeping partnerships going when an advisor has been with the organization for a while. Okay. We've already talked about initial onboarding and that people do some face-to-face orientation and meet with leaders ahead of time. If any of you have a particular, especially those of you that are coordinators, there was a few people who were interested in seeing what the outline of the orientation and the recruitment process was for advisors, just to see what different models there are. So if you have anything like that and you want to share it with the in the chat or send it to myself or Marie, we'd be happy to post it in the chat.
Mary, is this a good time for a question? Because I think there's a conversation that would be interesting, and I'm wondering because it's a concern about the perception that people may not be truthful if they are compensated. So does it make the person more likely to judge favorably? Mindy is asking, and I'm wondering, actually, Lindsay, if you wouldn't mind coming back into the conversation, because I'm wondering if this is something that we hear. Again, it goes back to preparation, support, mentorship, and then doing that annual reflection. But Lindsay, did you hear any of this when you did your environmental scan and your work on the compensation guidance?
Yeah, we definitely heard a lot of that. And we also heard those patient family advisors who wouldn't want to be compensated for many other reasons, like it would affect their Social Security pay and different things like that. That's why the guidance, it's pretty widespread. We're not saying advisors should be given this amount of money. It's really case to case kind of basis. But I think compensation in general, when you're looking for patient family advisors who are really internally motivated to partner with healthcare, compensation shouldn't be a factor in that decision-making process. So I think the first step is just finding those who are really motivated to partner, and then being able to offer certain forms of compensation. It may not be a stipend or anything like that. It may just be that they need travel covered to get to the meetings, or having a warm meal after the meeting, free parking, small things like that. So the guidance is pretty, it covers kind of the gamut of that entire conversation, because we had a lot of different advisors on this work group who had some conflicts of receiving compensation. We talked a lot about that, of what if we are looking for the wrong advisors when we're offering compensation. So we did cover a lot of that, and it can all be found in the guidance.
It seems like, thank you, Lindsay. It seems like one of the important things, because diversity has come up in the chat, is that we want to make sure that finances and don't get in the way of people being able to participate, so as to increase diversity. So so that it's not, for people who can't afford gas money or childcare, it's a non-starter, even if they might be very motivated to give back to the organization and share their perspective. And so I think the organization really has to be aware of how they remove those barriers, so that participation can happen. And so that may mean that one size doesn't fit all, but it sounds like you had a very comprehensive report. Looks like we've had a fair number of individuals weigh in on the facility question. Do we have a certain number of advisors, and is it a greater number depending on the organizational size? And people weighed in on that. Victoria, yes.
This is Angela Miney, and I was just wondering if I could make a comment, because I'm a paid advisor, and I just wanted to make a comment about the being truthful in your position. So I often joke with people and say, I get paid to complain constructively. And I've been in this position for a long time, and a long time being for about 12 years now. So when I started with the organization, there really wasn't a lot, there were no formal advisors, there were no formal advisory councils, and we've kind of all grown together into this. So I suppose people have become very used to me and my outspokenness. And I don't have a problem telling people what I think. And even though I get paid, they don't pay me enough to worry about whether I'm going to lose the job. But I never feel that it doesn't stop me. And I would just say as well, in relation to being the longevity and the passion, I just find that even though the organization I work in, we're not doing things perfectly. And, we had an advisory council, and then it faded for a while, but the organization has remained very committed to it. And that keeps me passionate that, I'm committed because my daughter got really good care here for a long time. And I want to see the organization being better, and they continue doing that.
Great. Well, thank you for weighing in on that. It almost, in a sense, Angela, you answered or responded in an indirect way to Kate's question about the whole issue of how do we sustain people's interest in in continuing to participate with us. And I didn't hear you say it was because they paid you. What I heard you say was that it was because they provided you with meaningful opportunities to make a positive difference. So if we can just go to the next slide, there's been some great chats around virtual PFAC meetings and using Zoom and using Microsoft Teams and those kinds of things. And so I encourage people to share more in the chat about that, and we can continue this information after we go. There's somebody talking that has a 719 prefix, but we can't hear you. Yeah, I'm sorry. I don't know if you're on mute or you've got your phone turned down. I'm sorry. We just can't hear you. 1719782. I don't know if you are on a cell phone and you don't have good connections. Perhaps you can chat it in. That would be great. So we've talked a little bit about mentoring, and so professional development is something that is really important. And I wonder if anybody does individual evaluations with patient and family advisors so that you can set training and professional development goals so that they continue to be excited and engaged about working with you.
Hi, it's Lena from Toronto.
Hi, Lena.
Hi, I just wanted to weigh in a little bit on this. So we don't specifically do evaluations for advisors, but we take sort of a two-pronged approach to professional development. So the first is when they've joined a new opportunity, whether it be a new council or committee, or they started a new project with a group here, I check in with them after 1 month and then 3 months, and then I also check in with the leadership. And if there's an opportunity for any discussion around, you know, challenges or opportunities, then we sort of talk it through, whether it be me and the advisor one-on-one or as a group. And then what we've done with some of these things that have come up is once a year we hold a forum for our advisor group. We currently have 86 advisors, so it's quite a robust program, but we're also a 5-hospital site. And so we host this annual forum where we take some of those larger overarching topics and we create these education sessions with them, whether we have a speaker or, you know, myself and a couple of sort of what I'll call them professional advisors come together, and we create sort of a training opportunity. And we do some professional development that way, and that we do find can be engaging as well for folks who you know, have been with us for quite some time and are looking to sort of refresh some of their skills.
Great. Sounds very comprehensive. Thank you so much for sharing. Natasha, if you can go to the next slide. I noticed that it's about 3 minutes to the top of the hour, and I want to be respectful of people's time. I wanted to share with you some an approach that you might think about as you're working with advisors, and it is to make time, whether formally or informally, to really probe to find out in a positive, strength-based way how things are working for the advisor. And so on this slide are a number of questions that are pretty open-ended, very positive and strength-based, and can begin to open up the discussion about things to help the patient and family advisor reflect on their experience. And this can be done one-on-one, or it can be done in a group. It might be a series of questions that your forum might answer. But we wanted to just share that as one idea that can help continue to engage and sustain advisors in their evaluation and their planning for how they, in partnership with you, can sustain their momentum and their effectiveness in working with your organization. And of course, appreciation and giving people specific feedback on how their input influence or can be very powerful. I remember working with one advisor who said at the beginning when he first got involved, he said when he showed up for meetings, he wasn't sure what kind of impact he was having. Sometimes we work on projects where you can't see the results immediately, but he said the thank you and the gratitude really helped him keep coming back until the project was completed, and then he could see how his input influenced what the product was. But the more specific the feedback you can give people about the difference they're making can really keep them engaged. And too often we don't give that kind of specific feedback, and it can be what sustains and helps people grow. So obviously we are not going to be able to answer all the questions people had and have a full discussion in just an hour, but what we hope these informal conversations do is that they get you excited, get you connected with other people, and encourage you to continue that discussion virtually on the PFCC Connect website. Natasha, if you want to change the slide. So I'm hoping that most of you are members of the PFCC Connect, and if you aren't, please do join. There's no cost to joining. And then you can join the discussion. You can answer a question, or you can pose a question, and then a number of people that have that experience can respond. I know that the questions that came up about working in children's hospitals and having PFACs that are pediatric or NICU are very different, and how do you work with that? Well, we have over, I think our membership is close to 2,000 now, and so we have people from a variety of areas that may not have been able to join our discussion, but might be able to share with you their thoughts to help inform what you're interested in doing. So we encourage you to do that. Next slide. I want you to just know what we're going to do as a result of this conversation. We're going to create a folder with this topic. We're going to put the conversation and the chat record in today's slides and any relevant links from our website to that space. And we encourage you to add any additional suggestions, links, or tools, and then begin and respond to questions that come up in that space, because it's through learning and sharing with each other that we can grow our own individual programs and also raise the level of partnership that's occurring out in the community to really promote patient and family-centered care. So we have some questions on PFCC Connect and how you narrow your connections. And so Lillian, if you'll send me an email so that I can get back in contact with you, I can show you how to do that. And so I want to thank everybody for joining us. I'm sorry we didn't have as much time as we could probably talk for hours about this stuff. I know that there was a lot of passion in the conversations that we did have. Thank you again for joining, and we hope that you'll continue the conversation at PFCC Connect and reach out to us. Next slide, Natasha. Many of you probably know we're coming to Nashville, so we hope you join us. But the last slide is around connecting with us. So please feel free to email us and reach out, because we value your partnership with us, and together we can continue to learn. Have a great day. Bye.
Thank you.
Bye, everyone.